Wrapping up hour number one here on a Monday. It's time for Sports Health, presented by Auctioner Andrews Orthopedics and Sports Medicine Institute. Bring back Dr. Jeremy Burnham, Medical Director of Sports Medicine and Section Head of Orthopedic Surgery over at Auctioner. Joins us on the Jim's Fire and Sightline. Dr. Burnham, how are you?
I'm doing great, Hunt. Thanks for having me.
It is our pleasure. I want to talk Achilles because that's the news nationally with injuries. But locally, we found out after the season was over that LSU's Daniel Dickinson played the last month with a broken hamate bone. That's now the second most famous hamate break in LSU history. Warren Morris recovering from his probably trumps it. But what can you tell us about what that must have been like for Dickinson over the last month?
Well, gosh, I think when I found out about that, just like everyone else, is super impressed with his toughness and, watching that game, had no idea. And the fact that, throughout all of those weeks, he's been able to get out there and compete and, just be a great Tiger is impressive. And I think that makes the story behind this national championship run even more special, when you had somebody playing through a fracture like that.
Is it one of those deals where it's just not going to get any worse? So if you can handle it, just go ahead and go?
Yeah, this is an injury that really happens batting most of the time. And, so for a right-handed hitter, it's usually your left hand, your hand that's touching the knob of the bat. Yeah. And if you think about as you're swinging through and making that contact and your hand is kind of rolling over that knob, that's rolling over that part of the hand where the hamate is. And so if you look at people's batting gloves and things like that, oftentimes you can see a lot of wear and tear in that spot. And sometimes it's a stress injury that just, that repetitive stress over and over just breaks it. Sometimes it's something traumatic, but either way, it's a very painful thing. Most of the time, the treatment for it is to go in there and take that bone out. Sometimes you can go in there and fix it, but most of the time you're doing a surgery to excise that piece of bone. But then you're usually out about 6 weeks if you have surgery for that. So obviously, from a timeline standpoint, I think he probably looked at that and talked to his team and said, "Okay, I'm gonna push through that." So for several weeks after that, push through with a very painful injury and continue to get out there and contribute to the team is really impressive.
It certainly was. I saw an article from the Associated Press up in Indianapolis talking about Achilles injuries in the NBA. Kevin Durant was famous, and Tyrese Halliburton obviously in Game 7. Is that something that y'all have looked into, and what have you kind of learned about that?
Yeah, I think that there are a lot of things that go into these Achilles injuries. One of the things that you're seeing with Achilles injuries in the NBA especially is that this used to be something that you saw in people in their 30s and their 40s. And now, like with Halliburton, you're seeing this in their 20s. He's 25, I think, when he tore this. And so there does seem to be a little bit of an epidemic of these types of injuries happening earlier. There's probably a lot of things that go into that. I mean, there's certain antibiotics that are known to be associated with tendon ruptures. Probably, the types of ways that we're training and things like that may be contributing to it. But we really think that just like many of the other injuries that we're treating, it may be also because people are specializing earlier. And when you play one sport 12 months year-round, that just creates very unique stresses on your body's tissues that if you're rotating through different sports, you're going to stress your Achilles during one season, and then maybe you're going to change that up for a different type of sport. So I think we're seeing people specialize earlier and earlier, and they're putting that repetitive stress across one single joint over and over, and that may be one of the things that is contributing to some of these injuries.
Got about 2 minutes to go here, Dr. Burnham, but I always want to give you an opportunity to talk about what's going on over at Elite. I know a lot of travel baseball, some injuries, kids just out playing a lot that are getting hurt because they're out of school. What's going on over at Elite?
Yeah, absolutely. So, I think that when we talk about the Achilles, I think the elbow is very analogous to that in a throwing athlete. So repetitive stress across the elbow earlier and earlier in people's career. In their sports career, we're seeing people specialize. And so obviously this is time of the year that unfortunately we're seeing a lot of elbow injuries. And there are a lot of things that go into it, but we think that specializing early is maybe one of the issues. And so I encourage everybody to keep cross-training. As a thrower, if you feel any medial elbow pain, you should not throw through that. A lot of sports, you need to play through certain types of pain and discomfort, but medial elbow pain in a thrower is not one of those. So you always want to get that checked out. We have an orthopedic walk-in clinic at Elite. We're at 5444 Burbank, on the corner of Burbank and Lee. And you can come 7 days a week, and you don't have to have an appointment. You can come in and get an x-ray. We do extended hours on Thursdays and Friday evenings, so it's open till 10 and 11 o'clock. And then on Saturdays and Sundays, we're open during the day as well. And so we're just trying to make it easy. If you want to get it checked out, maybe you've been having that pain and it's too inconvenient, you can't make an appointment, but we want to make that something that's a little bit more seamless for you to come get appropriate care.
Go check them out over there at Elite on Burbank. Walk-ins are obviously welcome 7 days a week. Dr. Burnham, we appreciate some time. Have a great week.
Great talking to you. Thanks, son.
Dr. Jeremy Burnham from over at Ochsner. You know, at Ochsner Andrews Orthopedic and Sports Medicine Institute, we know that sports injuries can be unpredictable, but one situation you can protect yourself from is heat illness. Some key signs to look out for include excessive sweating, dry mouth, dizziness, fast heart rate, or a change in mental status. Feel any of these symptoms, stop physical activity immediately. Find a place to cool off and replenish fluids. To learn more about sports injury prevention and treatment, visit ochsner.org/BRortho. Appreciate Dr. Burnham for a little bit of time.